Imagine for just a moment that you're in the hospital with an injury or an illness and the staff determines you can be discharged. Well, you and I would probably be thrilled to go home and be surrounded by loved ones to help us complete our healing. But what if you didn't have a home? Or loved ones? Well, all too often that's what happens to our homeless population. It's not the hospital's fault. They can't keep people in their beds indefinitely, and our shelters, well, they're not really equipped to help with rehab. Wouldn't it be great if there was a place our homeless population could go in between the hospital and whatever is next? Well, there is a place like that now in Las Vegas, and it's a model being looked at across the country. When we see homeless people on the streets, we usually assume there's a financial reason they are without a home. But all too often, there are medical reasons for their struggles as well. Like this woman who asked not to be identified. We'll call her Jody. She struggles with COPD, a pulmonary illness.
I've been hospitalized 11 times in 2 years. The shortest stay was 8 days, the longest 24. So it wasn't just minor things, on a respirator 3 times in a coma.
Not long after her last hospital stay, she ended up at the Courtyard, a homeless shelter and resource center in Las Vegas. That stay at the Courtyard ended up changing her life.
The rescue lady brought me over here, and I've been here for 2 weeks. I was homeless 2 weeks previous to that. Tomorrow I move into my own place. They have been marvelous. I have to say, I think they saved my life.
This is the Recuperative Care Center in downtown Las Vegas. The doors just opened here August 25th, and already they've saved or changed the lives of many people just like Jody. The motto here is everyone deserves a safe place to heal. It fills a gap in healthcare for the homeless, targeting 2 of the most vulnerable populations on our streets.
One would be folks that are being discharged from the hospital, and it could be because they've had surgery. They could have non-healing wounds, and they could have people that require wound care or maybe some intensive medical care for a series of 1-2 days, 1-2 weeks after being discharged from the hospitals. The other patient population that we're really looking at here is identifying folks that are homeless out in the streets that would have serious medical conditions that effectively could result in the loss of life, limb, or eyesight in the next 6 to 12 months due to their medical condition from being on the streets.
Dr. Mark Ogrifa oversees the medical staff here at this 24-hour facility. There are nurses, paramedics, certified nursing assistants, 38 beds, and 2 isolation units. But this is not just a respite center for physical healing.
In addition to that, we also have caseworkers, we have social workers that are able to go and put a continuum of care together, that we can identify gaps in the services that maybe they're not receiving. Maybe they're not getting the Social Security, maybe their Medicare, Medicaid components are not being addressed, and we have a team that's highly experienced here that have access to additional resources.
The idea was born out of the city of Las Vegas setting up the ISOQ during the pandemic at Cashman Center. It was a temporary facility for homeless individuals struck with the coronavirus. But along with medical help, it also had caseworkers on hand to help patients transition to a better life after being discharged.
Typically, you and I would be discharged home and we could finish our healing process, get back on our feet and move forward. And unfortunately for the homeless population, they're relegated back to the streets. And so it creates a cycle of returning to the ERs and these high-cost systems, and medical respite is designed to interject in the middle of that and hopefully break that cycle.
Here's how it works. The medical and community services teams work with partners in our city shelters and those who comb the streets aiding the homeless. When someone is identified as needing respite or recuperative care, they are encouraged to come to the center.
We don't want to necessarily recreate the wheel. There are organizations out there that do really good work. And so we want to collaborate, and we want to be able to join forces and really spearhead kind of this new approach of getting folks back on their feet.
Their very first patient was a homeless man who coded at the Courtyard, was revived, hospitalized, and then brought to the center. He went from dying to living on his own.
That being our very first patient, I said to the entire team, I was like, that's a sign. This is a center and a service that is badly needed for the most at-risk and vulnerable patients within our community.
The care center fills a gap in care for our homeless that was missing, not just in Las Vegas, but in cities across the country.
Working with the city, working with the Office of Community Services, means that we're in a position for the very first time, number one, to be able to provide that kind of those homeless healthcare services, but at the same time, we are setting a new model. And this facility, the way that we have structured it, the way that we have put the respite community services component together is the first of its kind in the nation.
And it is working. There are success stories in just weeks of operation.
If we don't break these outmoded patterns of behavior, then what are we doing all of this for anyway? And so even if someone does choose to return back to literal homelessness, maybe they down the road decide, wait a minute, there was something a little easier, a little kinder, a little softer, and let me give that another shot.
They call us guests, and that's how they treat us, as if we're guests. Ever since I've been here, they've treated me with so much respect and kindness and, care. And it gives you back your self-respect.
The center is located at 1581 North Main Street. Now, I asked them how long the guests are allowed to stay there, and I'm told they stay there until they're medically cleared. And in some cases, they can even stay a little bit longer if there's a housing unit being prepped for them.